Welcome to another Superior Health Wednesday. We're joined by Jim LaJoy, Executive Director with Superior Health Foundation. Thanks for being with us as always.
Absolutely. Glad to be here.
Absolutely. Thank you. And today we're diving into a topic. We're talking about planned giving. And this is something that, Jim, you've got a lot of experience in, you've got a lot of background, and kind of talk us through your experience with planned giving.
Well, thank you, Ben. One of my first starts, first jobs that I had working in philanthropy was as a major gifts plan giving officer with the former Marquette General Foundation. It turned out to be a wonderful, wonderful opportunity to get to know people, to really dive into what some of their interests are and how a legacy type gift can really make a transformational difference for a nonprofit foundation. So, I got some training in it, and then I learned from some of the top people in the field and read a number of books on it. But really, it's all about relationship building. It's all about learning what's important to people, as they enter different stages of their life. And what I have found over the years is that for a number of donors, during their lifetimes, they may be supporting, obviously their retirement, their children's education, and there may not be a lot of extra dollars to go around to those charitable organizations that mean something to them. That's why a plan gift is just so incredibly important, because you can set something up in a will, a trust, or part of your estate plan, where when you pass on, assets can go to a charitable foundation. So I've worked with a number of donors over the years on this. Fortunately, we're in a spot where we have a number of donors and families that have included the Superior Health Foundation in their will and estate plan. And it's a wonderful, wonderful way to make a significant impact with really not a lot of work and not a lot of planning that it necessarily has to go into it. It's a relatively easy process, and we can discuss that today.
Yeah, let's just to be clear about it. Let's kind of talk through that process. If, 'cause, I mean, when do you get started? How do you get started with setting up that gift?
Yeah. Well, typically what we do, and we spend a lot of time, as we've talked about before, with some of our top donors, and we form a relationship and really involve them in the things that we're doing, and over a period of time, when we recognize that there are certain donors that really want to make a difference and they want to do something more that's substantial. So part of that is just learning about their needs, learning about their wants, and then just sitting down with them and having a conversation about it. And we've done that a number of different times. We've sent out literature. We've had lunch with a number of folks, and basically just kind of set the table about what do you want as part of your legacy? Do you want to support your church? Do you want to support another nonprofit in the area? And really, it's a nice way to set it up in a will, that you can designate a certain amount, a certain percentage, or a certain amount that's going to go to a nonprofit upon your death. So we've seen it transformational. We've seen a number of donors that said, "Boy, I wish I could do a lot more today and help you." And our response is, "You're doing a lot, but what about when you get near the end of life and you're looking at your assets and you're looking at what more could you possibly do? You could consider us. You can consider Superior Health Foundation as part of your planned gift." And the thing that I tell folks all the time is that this isn't a one all or nothing proposition, because you can include a number of different charities in a planned gift and make that possible. So it's a process that I've worked with folks on. I've sat down with them, and in some cases we get an estate attorney involved and have those conversations so we can have the proper documents and the proper signatures in place. But in some cases, it's just as simple as leaving a percentage or leaving something in a will. And some of those we know about, and then there's those that we don't know about. I often tell a story. Several years ago, I received a phone call near the end of the day. It was on a Friday, and on the other end was someone I didn't know, but it was an attorney who was calling to let us know that wanted to start your weekend off on a good note, that one of their clients who had passed away, reviewing the will and estate plan, had left about $250,000 to the Superior Health Foundation, and thankful for all the work that we did in providing those grants all across the Upper Peninsula. So that was pretty phenomenal. And those are the ones that you remember, but there's other ones out there that may fall into your lap and you may not know about. But it's just planting that seed and then working with donors to see what fits their interests.
So, and I think that's good. And there's never really a bad time to start a will, because life can happen, things can happen, and it's better to be prepared. So if you don't have a plan for it, it can get a little bit complicated. So even for somebody who's just starting out in their career, is this something they could pay into if they wanted to start a fund, just the same way they'd be paying into a retirement account?
Yeah. Yeah. And to your first point, it's never too early. Never too early. In fact, this weekend I was with some friends of mine, and we were just talking about putting together a will. And it's surprising the number of Americans who do not have a will. And that's incredibly important, particularly near end of life, to make those decisions for you and your family. But, a lot of folks wait on it, but you can get started on it. I know personally, my wife and I put ours together probably about 10 years ago. And we had a pretty clear idea of what we wanted to do and how we wanted to give back. And essentially, it's assets that you have, and designating a proportion of that to the charities that you want it to go to. So, it's I think a lot of times as Americans, we spend, we have other needs. Obviously we've got food, clothing, shelter, we got our job, and there's all those other needs, and there may not be a lot of charitable dollars to go around. But a plan gift is just a wonderful way near the end of life to recognize and really give something transformational to an organization or organizations that mean something meaningful to you. And the nice thing is you can designate it to an area of greatest need. You can designate it to a specific fund. We've talked to donors who have an interest in supporting our breast health fund that we're working on this month in October. To make a transformational type gift and put something there for that. So we're here to listen, and I'm here to talk to people about it to see what is of interest to them, and then just go through that process.
And as far as the ease of giving, is there ever an expected amount or a good amount as part of a planned gift, or is this really whatever you want your legacy to be, whatever your ability to give is, that's okay?
Absolutely. Yeah, absolutely. There's no amount. And I think that's where sometimes the confusion comes into play with the planned gift. I think some people hear that and they think, oh my goodness, that's like giving away $1 million. That's like giving away $500,000. No, it's not anything like that. I've seen planned gifts that were as small as $1,000, and I've seen them as big as $1 million. It's really what fits into your budget, and what fits into really what your heartstrings are telling you to do. And that's a personal decision, and that's a decision that you make with your family. I'm there to help you guide people with that decision making, and at least point them in that direction. And in some cases, I've had discussions with donors about making a planned gift. And there's rare cases where, after having discussions with them, I found that, really we might not be the area where they'd like to direct it based upon those conversations. So I give them some advice on some other organizations that they may want to include. And then, as we talked about earlier, it doesn't have to be one organization. I've seen families and estate plans that have money going to 8 to 10 different charitable organizations. And that's all wonderful because, as we know, there are a number of nonprofits, aside from us, that could benefit from a legacy type gift.
I like that idea of just having something that it's set aside, it's planned for, and then at some point, something that you cared about in the community is going to get a really nice surprise. The amount isn't really important; it's being thought of and having something contributed to there.
Yeah, I agree, and I think it's just that good feeling, the feeling of giving, the feeling of giving back, and and those surprises are pretty nice. I've talked to other leaders in the nonprofit world about planned gifts that they've received, and we're happy for them. We're very happy for them because those types of gifts are so incredibly meaningful, not only for the nonprofit but for the families. And there are a number of folks who look at it as like, I wasn't able to really do something big while I was living, but now I'd like to be able to give back, and I'd like to be able to do something to really help out an organization or organizations. And there's case studies all across the United States of different types of planned gifts that were just huge, whether it was a university, a hospital, a library, a museum, or some type of health organization similar to ours that really makes a big difference.
And I think that's knowing that there can be any size, any value, and spread it however you want, but just setting that intention and doing that is a big part of that, and just starting the conversation with you to see how that could work and what your possibilities are. Because I think for a lot of people, this isn't something they've probably heard of before, and they have no idea where to start.
Right. Absolutely. And again, we're here to help them with that decision making. And then another important facet to this, Ben, is that let's say you already have in place a will and estate plan and you haven't considered a planned gift because you did your will and estate plan 10, 15 years ago. Well, the beauty of it is you can consult with an attorney, an estate attorney. You can take that will and you can easily do an addendum to that will. That's not that difficult to do. An addendum just saying that, upon my passing, I'd like to leave, 5% of my assets to a certain organization or a certain dollar amount, and then just get a signature on it. So we've done that a number of times. And fortunately, we have a number of attorneys in this area who are really, really good at this. And that's what they do for a living. And, we always ask our donors to please consult with an attorney, talk to them. And in some cases, we can all gather together to see what's best and to see what the next steps are to complete that process.
And that's one of the big things that you all do is, and we've talked about this a number of times, is just that you listen, you help people navigate these things so that they can give and live generously, and however that looks for them, you'll find the right fit so that we can continue to support each other in the UP.
Yes,
so.
Absolutely. We do listen, and a perfect example of this is a conversation that I have right now ongoing with a donor in Marquette that we spoke to a number of times. This donor learned about the fact that we have an organ donation fund that's available for those who are receiving a transplant or are giving an organ. And it's a fund available to help them with expenses for that. And the donor I was talking to says, you know what, this has affected my family. I've had family members who have gone through this, and I didn't realize there was a fund like this. I'd like to learn more and potentially set aside some dollars for this in my will and estate plan. So that's a discussion that's ongoing right now. And again, that was from just having a conversation about what's important to them, how do they want to do something down the road when they're no longer here to really make an immeasurable difference in the lives of people.
And that's really powerful, and thank you for sharing that story. I think we're trying to connect people with the right sources and the right way to kind of direct their generosity. But is there anything we've missed today in our conversation about planned giving that we want to make sure to address?
Well, I think the one thing, Ben, is that we want to make sure that people are educated about it. They can go to our website at superiorhealthfoundation.org, and there's an icon at the top about planned giving. My information is up there. And, just educate yourself on how important this can be and how you can be part of something special. And if that is of interest to you, be happy to sit down and talk and just have an informational gathering session to find out what's important to you, what's important to your family, and we can kind of get the ball rolling to figure out what may work best for that particular donor.
Okay. Well, I appreciate you taking the time with us this morning and sharing this good information, educating me and hopefully a lot of other people so that they can start planning this process.
Absolutely.
All right.
Happy to do it.
Thank you. We'll see you on the next Superior Health Wednesday.
Okay, thanks a lot.
Yeah.